So if there are coronary arteries rather, there are coronary arteries. There are also veins, no, that will drain blood coming from the myocardium, from the ventricular and atrial walls, no? So running alongside the anterior interventricular artery is supposed to be the great cardiac vein. So we cannot clearly see, no? Very difficult to isolate and separate the vein from the artery, since it is covered by deposit of fat, and I'm afraid if I do further dissection, I might transect and damage the arteries. But you can see, no, the great cardiac vein runs alongside the anterior interventricular or anterior descending, and then its more proximal segment, no, is right here. More proximal going to the coronary sinus. The coronary sinus is a large vein. The more proximal segment of the great cardiac vein drains into the coronary sinus, and the opening of this large vein called the coronary sinus is found in the wall of the right atrium. So this vein you also have a vein running alongside the marginal branch of the circumflex artery. Then we have the posterior interventricular artery and veins here. So this is the atrioventricular groove between the left atrium and the left ventricle. So we have the inferior vena cava here. So if there is a great cardiac vein here on the left side, there's also cardiac vein running alongside the right marginal or right acute branch of the right coronary. Again, we cannot clearly separate or isolate the vein, but you can see darker vessels running alongside the right marginal or the right acute branch. So those the vein right there is actually the small cardiac vein. Small cardiac vein on the right, and then we have the great cardiac vein here on the left. So I guess there's one more artery which was not identified, no, in an earlier video. This one is the atrial branch of the right coronary artery. Atrial branch going to the right atrium, and actually has its distal segment, no, goes towards the area where the sinoatrial node is located or found.